Welcome all. We're so excited to have so many participants and a wonderful selection of panelists today. I'm Annie Dotson. I work over at Duke University as a breastfeeding medicine physician. And do you want to introduce yourself?
Yeah, I'm Anne. I am a clinical social worker, also at Duke Family Medicine.
Wonderful. We're going to have each of our panelists introduce themselves as they answer questions. So you'll get to know them throughout the session today. Just as we're orienting to our panelists today as well, we'll have a section after a couple of questions where we'll be able to answer some of the Q&A in the chat. So please feel free to use the chat, and those questions will be addressed kind of in a lump at the end of each section. So we're going to start today talking about barriers with bridging our gaps from birth to breast. So, starting with the question, can you share your experiences or observations about the most significant barriers to breastfeeding support? And thought we would start with Nikki Young.
Hey everyone, my name is Nikki or Nicola Young. I'm a lactation consultant here in Durham and also a medical student. I got involved in lactation through work first as a birth doula and finding that a lot of my clients were kind of stuck after delivering and not sure where to go with lactation support. So I wanted to learn more about it so I could be a resource there. I have focused a lot of my work in the recent years on the Spanish-speaking community in Durham, supporting Breastfeed Durham with the Lactancia Latina Coalition. My family is from Peru, and so I grew up speaking Spanish and have dedicated a lot of my work to supporting our Latinx population here in Durham. And I'm excited to share some experiences and observations that I've had about specific barriers to breastfeeding support, specifically with the Spanish speaking population. I think, like, as y'all can imagine, the biggest barrier there is language to start, right? We have interpreters in healthcare settings, but if anyone's worked with an interpreter, you know how challenging that can be and how much more time it takes to care for a patient when you're using an interpreter. And so I think that not being able to connect with caregivers in your own language is a huge barrier for Spanish speaking families when it comes to lactation. I think that although healthcare providers can be extremely well intentioned, the folks that are actually having to use the interpreter on the other end, like on the patient side, they're less inclined to ask questions, to reach out for help when they're struggling with lactation, and to necessarily clarify if they have questions about any guidance that they're being given, because it can be awkward and challenging to have that go between with an interpreter. I think also, our healthcare workers are extremely busy and have a lot on their plate. And when you might hear from a Spanish speaking person, which is kind of like a common stereotype or trope, or what you hear people say a lot is that they choose los dos when they're choosing their feeding plan, which is a combination of both breast and formula. That maybe there might be less attention placed on them and getting them to establish a good breastfeeding relationship or work on strategies to extract their milk with the breast pump, for example, because you might say, well, they're just going to give formula anyway. And I think that that does a huge disservice to our Spanish speaking population that a lot of times is kind of in getting care in a new space, not somewhere where they necessarily grew up and not in the community that they're from. And maybe they don't know what the possibilities are of extracting their milk and giving it, or what their rights are to pump their breast milk at work. And I think that if we had the luxury and the desire to spend more time with those families, kind of helping them build out their plan and even understanding the possibilities of being able to provide their milk when they aren't directly with their baby, I think we could do a lot better in caring for our Spanish-speaking population in that sense. Um, I think as far as the language barrier goes too, there's a ton of resources in our community for lactation. At least in the Durham area, we're super lucky to have a ton of support for lactating families, but not a lot of those are necessarily catered towards Spanish-speaking families. And if they are, you really kind of like have to know the right person to know that they're happening. And so that's definitely a barrier too. I'll just touch on a couple more things and then share the mic. But I think there's a myth, at least in the culture that I grew up in, and also with a lot of the families that I've worked with, that it's normal for breastfeeding to hurt. And I don't think that that's necessarily just for Spanish speaking or Hispanic populations. I think that's true across the board, or not, maybe not across the board, but in a lot of different cultures. And when it's hard to ask for help because of a language barrier, because you're not in a place where you're comfortable, and also if you grew up with a culture that's like, you're just kind of, as my mom always told me growing up, like suck it up and get through it. I think that that can also lead to maybe less than ideal breastfeeding outcomes for families who could really maybe have a lovely breastfeeding relationship that isn't painful and not something they dread, if they were able to get the support they deserved. And then the last thing I'll say too is the Spanish-speaking population doesn't necessarily mean the immigrant population, but in a lot of cases it can, or that can be a shared identity for our Spanish speakers. And so I think those of us who are in the lactation world and have seen the research know that having social support around raising your kid plays a huge role in being able to have the breastfeeding outcomes that you're hoping to have. A lot of immigrants don't have that. They don't have their family that they grew up with. They don't have a lot of friends in their area. And so I think that that also plays into a lot of the reasons why maybe breastfeeding outcomes might not be as ideal as they could be in that population. Other things I'll just mention, but won't go into, when in the immigrant population, we think about the fact that most folks have to return to work pretty soon after giving birth. People don't have access to health insurance, which can complicate getting lactation visits paid for. And then just not having transport is a huge issue into getting more lactation support. So I'll pass it off to the next person, which Dr. Dotson help me out. I'm not sure who that is.
Thank you, Nikki, for those thoughts. That was wonderful. Amber, do you want to weigh in on barriers to breastfeeding support?
Yes. So I'm Amber Cruz. I am a Durham Low Lactate League leader. So I work peer to peer with people as a very proud lesbian Low Lactate League leader here in Durham, which still surprises me because we have such a vibrant queer community in our area. I keep expecting more of us to pop up, but we don't yet. And I also, until very recently, ran the LGBTQ coalition with Breastfeed Durham, making sure that queer and trans voices were being brought up in conversations like this. So I love that Nicola brought up an obvious language barrier. And so when I'm working with people on the LGBTQ spectrum, it is a safety barrier. It is an identity barrier. So it is not necessarily a lack of a common core language that's spoken, but it is finding providers that you trust, that understand your gender identity, your sexual identity, your family makeup. So if you are lactating because of gestation, that doesn't even guarantee that you're going to find lactation consultants that are going to respect even what your spouse is called or what you want your baby to call you. Like these very simple things that those of us in the queer community are used to asking, like, what would you like your baby to call you? What can I refer to you as a parent? Just these very, what is your pronouns? What gender? Like, just very common. When I work with queer families, what I think of as second nature are still not second nature in the broader healthcare space of lactation support. And then deeper in that is a lack of information on various human milk feeding options, as in possibly induced lactation, co-lactation, information on if you've had breast surgery of any kind, could you still lactate? A lot of these families are not even being told, hey, you've had top surgery, but you still have mammary glands under your armpits. You may start leaking milk. That may be not what you want. Also, especially if you're working with a trans person who's chosen to gestate, there can be tremendous gender dysphoria that's happening during this experience, and it takes some special knowledge on supporting that mental health, supporting that person, and especially with lactation, because if they don't identify as female, they've chosen to lactate for various reasons, how to support these people takes some special knowledge, takes some special time. And there are some really great resources out there, not a ton, but they're coming more and more where you can do special webinars and trainings around supporting translactating people. So representation, feeling safe, feeling seen, and then broader, we talk about one of the steps towards a breastfeeding friendly community is representation of human milk feeding. But sometimes that representation is a very heteronormative picture. So even so much of what picture books are we putting in preschools that show human milk? Do any of them also show non-heteronormative families? So those are just a few of the very big, broad things that I think affect queer families reaching their human milk feeding goals.
Thank you, Amber. That was amazing. And I'll just remind everybody to continue using the chat for questions. We have Bernadette here, and I'm going to see if she's able to weigh in or at least wants to say hello. Bernadette, are you available?
Hi everyone, how are you doing today? I am a little under the weather, well, a lot under the weather. So I just wanted to just try to see if I could just listen in.
We
Is that
appreciate you, Bernadette, being here and such a knowledge base as well. If it's okay, we'll go to our second question. So, looking at collaborative strategies, what are some successful examples of interdisciplinary collaboration that have improved breastfeeding support in your practice or community? And we're going to start with Alicia. If you'll introduce yourself and tell us your thoughts.
Hi, everybody. My name is Alicia Bailey. I am currently the WIC and Breastfeeding Programs Manager at Piedmont Health Services. I'm an IBCLC, and I've worked with the WIC program in North Carolina for the last 15 years. Piedmont Health Services is an FQHC, which is a federally qualified health center. We're one of the largest perinatal providers in North Carolina, with about 440 births a year. We serve over 44,000 patients for primary care. So we are lucky in that we have our WIC and lactation programs embedded in our community health centers, where we provide primary care. And in thinking about lactation, being able to co-locate WIC and lactation support with our perinatal services is really just a lovely, lovely option for us. One of the things that we really strive to do is capture the opportunity to provide support and education when patients are in our clinic spaces for other things. So we have been piloting what's called a team-based visit. So we do perinatal team visits in our clinics at the 28-week mark. So when our prenatal patients come in and are doing their 1-hour glucose tolerance test, they're usually sitting around in our clinic for about an hour before they go into the lab. So we utilize that hour of dead space to bring our WIC and lactation team in to provide prenatal breastfeeding education, to introduce them to the WIC program, to introduce them to the WIC breastfeeding peer counselor program, get them enrolled, get them connected to a peer counselor, answer some of their questions, do some one-on-one counseling and support. And then we also do a team-based visit and bring lactation and WIC back in at that newborn visit. So when they first come out of the hospital, that first visit back with a provider to see the newborn, we bring our WIC breastfeeding support folks back in. So that's lovely. Another thing that we've been doing is we have partnered with our local critical access hospital in our rural county here in Chatham County. So we have embedded one of our WIC lactation professionals in that hospital's maternity care center. So they are rounding daily with the mom baby dyads that are on the unit, and making sure that they get daily lactation consults, that they get enrolled in WIC before they discharge, and they get issued any breastfeeding supplies that might be needed before they leave. So they don't have to worry about trying to connect with WIC or trying to find a pump in those early days after discharge when they really just need to focus on healing and getting to know their baby. So those are some of the big things that we've been doing, just trying to make sure that we're partnering together. Another couple things we might be doing is partnering with the local health department to do prepared childbirth classes in English and Spanish. We'll send one of our WIC peer counselors to those classes to provide a breastfeeding element. So they'll provide some breastfeeding education. They'll introduce themselves as the local breastfeeding support. They'll connect with those families so that they're able to access WIC breastfeeding support through a familiar face once the baby arrives. And the health department in Chatham County recently launched community health nurses who are doing newborn home visiting. So our WIC peer counselors will go on those home visits as well if that family is breastfeeding and connected to WIC service, and will provide some in-home lactation consults at that visit alongside the community health nurse, which is really exciting. I am going to pass it along next to Kim, who is my colleague here at Piedmont Health Services. Kim, go ahead and introduce yourself.
Good morning, everyone. My name's Kim. I'm also with Piedmont Health. I'm the WIC Assistant Manager. I'm also an IBCLC with Piedmont Health. So to echo a lot of the things that Alicia already mentioned with our community partnerships and our other partnerships with the health departments and hospitals, we also partner with a lot of the schools in the area, and we take on a lot of the interns, whether they're didactic interns and lactation interns. And I think that's a critical part in, spreading awareness of the need for breastfeeding support. And I love working with these students and exposing them to a community health center where they're interacting with a very diverse population, but also they're getting the chance to see what it's like to work in a rural community setting. And having that background, I think, really helps to aspire new breastfeeding support people to get into this field and see the importance of having a variety of practitioners, lactation consultants, doulas, all those people who are part of the care team of a pregnant person who before and after delivery. So I really highlight the importance of that type of collaboration and training students to seek out more breastfeeding education and support. And then also if they're into the policy side, I've had several students who were really interested in breastfeeding policy work. And so just providing them with resources and connecting them with local organizations like Breastfeed Durham, Breastfeed Orange, and connecting them to those kind of community resources is really critical. Yeah, and then I'll just pass it on to the next speaker.
Thanks, Kim and Alicia. Stephanie would love to hear success stories from you.
Hi, Annie. My name is Stephanie McQuady, and I am the founder and the executive director for Nourish and Thrive, which is a breastfeeding equity focused nonprofit, just really trying to make sure that folks in the Black community get the support and celebration that they need to continue in their journey with breastfeeding. And when I think about interdisciplinary collaboration when it comes to breastfeeding and how that's so critical to the community and meeting those needs, I immediately think about the work that Breastfeed Durham does, because it is so important to think of all the different facets of interaction with these families when it comes to lactation support. And so when you think about Breastfeed Durham and the community, you think about how they advocate in public health spaces, with WIC, with local hospitals, making sure that families get the support that they need on that local level, because that's really imperative, because that's really their first line of resource. And so making sure that hospitals are breastfeeding friendly, making sure that you have a WIC breastfeeding peer counselor available to help you, making sure that you have breast pumps. Those are things that are crucial when it comes to everyday parents in their walk in life as it pertains to breastfeeding. Um, for my organization, one of the things that we do at Nourish and Thrive is that we offer lactation classes, prenatal and postnatal lactation classes, and we partner with people who have lactation credentials to offer these. And the information is very basic information. It's things that if you're in the lactation space, you kind of are really very familiar with, but it's things that everyone doesn't have access to. So a family may not have $40, $60, $100 to pay for this breastfeeding education class on a regular basis. And so we're going to bring this opportunity to get that knowledge in your head before you even give birth so you can start by making the best choices possible if that's an availability to you. And I think that ultimately we have to continue to focus on all people who are involved in like not just lactation, but infant care have to be working across sectors to support families when it comes to lactation because this is really sometimes a matter of life and death, and sometimes it's just quality of life for a lot of infants and a lot of families. And so I think Breastfeed Durham is a really great example of how that works on a community level. And it always is one of my first thoughts when I think about how the community can work together and with other providers in the community, whether that's doctors, whether that is a hospital, whatever it is, if we see something that's not equitable, or we see something that maybe is falling through the cracks, but speaking up and talking to our representatives, right? Because we know that we have the power to do that. And I think that's a really good example of how I see on a daily basis our communities just working together to really support families.
Thank you, Stephanie. I'm going to circle back just to identifying barriers and wanted Love to weigh in about some gaps that she's identified.
Well, I wanted to loop back and speak on behalf of Bernadette, since I was like, it just feels like we're missing something if we don't bring that back in. My name is Love Anderson. I am one of the co-founders of Breastfeed Durham. 7 years ago, I was a peer-to-peer lactation support provider who was approached by a nurse from Family Connects who had discovered yet another 10-step public health project called the 10 Steps to a Breastfeeding Family Friendly Community. And she convinced me that we would start implementing this project with just 2 people, and now we have 2,000. But I just want to call us back to when folks talked about how many resources we have and how much collaboration there is, that 7 years ago, all we had in this whole community were 2 League meetings. That's it. They met one during the day, one at night. There was no diversity in lactation support, and I desperately got the attention of the community because I just wanted to see a brown nipple at these lactation support meetings because I was so surprised that our peer-to-peer lactation support, while incredibly supportive of lactation, I was surprised of the lack of racial diversity. And I recognized that we have a very large Black community in Durham, a very large multiracial community. Our rates is particularly supporting Indigenous folks, which is a small percentage of our population, but still non-trivial in North Carolina. We were struggling even with parents who were women who identified as women of color with high incomes, with high education. We continue to see these questions coming in to our groups as we started to grow our diversity about struggling with lactating at work, where to find childcare. And we are so privileged to bring Bernadette on to bring in those extra perspectives with her experience working with Head Start and the struggles on accessing affordable health care. And we were just so angry about having to get in our car and drive to our neighboring community. The county right next door had 16 peer-to-peer lactation support meetings per month, while we only had 2, and yet we had 3 times the population over here. And we just thought to ourselves, if we work together, could we make change? But one of the biggest barriers we saw is families were tired. And rather than asking moms, parents, people with newborns to do more, we wondered if we could ask systems to do more. So we looked at that 10-step project, but we knew that one of the biggest problems when we look at public health documents is if you just say the word families, sometimes for us, we were afraid that Black families would get lost. And so we looked at the 10 steps where we added those culturally affirming words in front. And at first we added Black women. And then people said, hey, 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 what about LGBTQ families? What about Spanish speaking families? What about Asian families? What about the really rich diversity within the Asian and Native populations and how those statistics sometimes folks get lost. So those are the gaps in care we've been working on, and y'all make me want to cry a little bit because I'm hearing a lot of positive change, even though we're still struggling with pieces. We've come a long way.
Thanks, love. Just amazing, all of you. We have some time to answer a few questions about our successes and some barriers. If anybody has questions, feel free to pop on, unmute yourself. Feel free to put something in the chat. I thought I might just push back to our panelists and ask, these are amazing success stories and really inspirational. And I think my question is, well, where do you start? Like, I love that this is where we've come, but I guess thinking about the individual, where can the individual start? What can we do to really also have these success stories and move the step forward?
I'd love to pop in on here. So it's great to go back in the past. So 3 or 4 years ago, when I was starting this queer queer coalition, and still having queer voices in lactation advocacy is still very much a minority. We're not here often. One of the very first things that we did in the first year was simply scour all of the interwebs and start gathering resources.
We'll do that.
So
Okay.
taking, my time to scour resources, and we have a different local page, and those are not just a list of names. They all come with either lived experience or recommendations that you are indeed queer friendly. And if I got a report that a place wasn't queer friendly, then I would investigate it. That is a very curated local list that you can go in on Breastfeed Durham for LGBTQ plus friendly spaces. And then we also did that nationally for medical providers or any national or international, but was in English training. And the list isn't extensive. This is still new research. But what's really telling is this volunteer run by 3 people list started to get picked up by all these different places around the country, because when you are Googling LGBTQ resources with lactation support, we pop up. And I just say we as in not paid, not extensive, the best that we can have. And that's where we got started. So I think sometimes simply gathering information can be the first big step. So people can go to one site and say, oh, I can have training for my staff to be more trauma informed when working with my trans clients who are choosing to lactate. Like, oh, there are resources out there for me to get better. And for local families, because it's all intersectional, right? So what if you're a Black queer person who has gestated and you have a trans husband, and like, where do you go? Right? We did our best to at least have a starting spot of these are vetted places. We focused on Durham. We need help expanding that list so that if we got more people in Chapel Hill, got more people in Raleigh, like it needs to be expanded. But I think resource gathering is sometimes a boring and overlooked thing that I think is actually very impactful.
Thank you.
I'd love to add that I think one of the simplest things you can do is volunteer. And I come at that from a background of being a volunteer and also seeing just kind of how much that's disappearing right now. In a community, we need each other. And that doesn't mean that you have to necessarily volunteer all of your time because that is very precious for all of us right now. But if you have a skill set or if you have like an hour a week and you say, hey, I can do this for you because I really believe in what you're doing, that makes a huge difference, especially because a lot of organizations are struggling for funds, can't always pay people for the work that needs to be done. And we're doing this out of our love for lactation. And so if there's an organization that you really align with their morals or values, just saying, hey, what can I do to help you? Maybe I don't have money to donate to you, but I have 2 hours a week that I could give you makes a huge difference in being able to help with the work that's being done because it's a lot of work and a lot of it is unpaid. And so volunteers really are the backbones of different organizations.
I would love to add, that the saying that progress moves at the speed of relationships. So recognizing that either as a community member seeking services or someone working from the healthcare side of things, if you see something and are frustrated with either the lack of resources or lack of support or the way that support and resources are being provided, share your frustrations, but also think outside the box and share some ideas and some solutions for how to work through those things or improve them. We work better together with all of our brains together, and the worst thing that will happen is that somebody says no thank you, but you might propose something that they hadn't thought of, or in putting your brains together might come up with something even better or more effective, or that better meets the needs of the community than individuals might have come up with on their own. And I think solutions are always better coming from those who are either directly patient facing or those that are in the community, as opposed to those in a leadership position within industries and systems coming up with ways of providing services. So I just encourage you, wherever you come into this conversation in this space, to put yourself out there and share your ideas and your creative solutions, because I promise you, you will be surprised with the reception that you get.
And I just want to build off of Amber, Stephanie, and Alicia and add that I think we're hearing the collaboration between healthcare providers and community providers, if we want to call them that, or community members, community services, makes a huge difference in if you don't know which community services exist or who the people are at those agencies, it makes it really hard for you to share that information in a trustful way with your patients. And so if you can go out to your WIC office or to the nurse home visiting program that is offered for free in your community, or to like a local lactation clinic and meet the people there, let them know that you're there, and then you can refer your patients or tell your patients about these resources that exist and let them know like so and so works here and they're great and you're going to have a great experience with them. This is how you get there. I think that makes a huge difference for people, and connecting to one resource leads them to connect to others. And it's just like this beautiful snowball that can start with healthcare providers.
Thank you all. That was so lovely. Any other questions that people have regarding successes and barriers before we move into our next part of the talk and panel? Please feel free to unmute yourself if you have a question. We're going to go ahead and Anne, do you want to talk about our next section?
Absolutely. Yeah, so we'll move into this. We will have more time at the end if more questions pop up for folks. But as we kind of think about some of these solutions, what specific tools or resources have you found effective in addressing cultural and linguistic barriers within lactation support? So Nikki, I'm going to pass it right back to you.
Thank you. I mean, I think the obvious answer here is having bilingual providers, but because we can't magically make everyone speak every language, I think that if you are able to take time to really engage well with an interpreter and your patient in a healthcare setting, it makes the world of a difference. And like show your patient that you care and want to hear their perspective and aren't just rushing through because it takes so long with the interpreter, can really like change a person's lactation trajectory. I think as far as kind of like building off of what my previous comment, I think that for specifically for Spanish speaking families that are immigrants or new to this area, trust is a huge issue and barrier to receiving care. And so if you are able to get to know the places that you might be referring or letting your patient or client know that they can go to receive more support and be able to like give a bit more of a warm handoff so that they know that you trust the person that you're sending them to, then they can also trust them and feel more confident going into a new and potentially scary setting. I think that a specific resource that I can think of here in Durham is our Family Connects program, which is our free nurse home visiting program that has bilingual providers. And goes into the home and the postpartum period and is able to do a nursing visit checkup for the parent and infant, and they are able to then be like a resource hub where they can connect people to a lot more resources and specific lactation resources that will best suit them. And like it's through that venue that at least kind of in our community we're seeing that people are able to get access to free pumps with that they might not have access to because they don't have insurance or low cost lactation support. And so that has been like a huge success, I think, and being able to connect or fund that program, I think would do our community a lot of good. The other program that I really want to echo as a super effective resource in addressing these barriers to lactation support is Centering Pregnancy. I have seen an incredible benefit to the Spanish-speaking families that have been able to grow in community with their counterparts that are also around the same gestational age and going to their prenatal visits together. Because, as I mentioned before, not having a lot of social support can be a huge barrier to lactation success. And so, being able to build that throughout your pregnancy in a safe space and then like continue that communication beyond. So, if someone has a lactation issue, they can like crowdsource the group and say like, oh, actually, I heard about this resource. You can go there and get more support and that kind of thing. I think makes the world of a difference. Yeah.
Thank you so much, Nikki. I am a big fan and a graduate myself of Centering Pregnancy. I'm going to pass it over to Kim to talk a little bit about tools and resources.
Yeah. So I think one of the things that I have found successful is just talking with the WIC participants that I interact with on a daily basis. We do interact with mostly Spanish speaking communities at Piedmont Health, but we do also have a very diverse population of Asian participants, primarily Burmese and surrounding area populations. So we work a lot with refugee communities in our area. And so connecting with refugee community organizations is really helpful. I was also part of Breastfeed Durham's Tea and Milk Coalition. And through that coalition, I was able to create connections and talk to providers across the country because unfortunately, on the East Coast, we don't have a large resource bank for Asian American, Native Hawaiian languages and people working in that area. And so I was able to connect with people in California who are doing great work, specifically in the collaboration with Breastfeed LA and also with the Asian American Native Hawaiian Lactation Collaborative. They've created a really great online resource bank for these populations to access breastfeeding education, different resources that are translated in Vietnamese, Mandarin, Cantonese, Burmese, and a lot more extensive languages that aren't always available on the East Coast. And so I think making those connections across the nation through other organizations is really beneficial in accessing more linguistic um, resources and also giving us different ideas of what linguistic services can look like in the medical space and in lactation as well. And so having those connections can be really fruitful in building partnership, but also developing ideas of how to better our practices here. Yeah.
Awesome. Thank you so much. And Love, I'm going to pass it over to you.
I would say the most transformative support that I've ever seen is peer-to-peer lactation support. And I was really privileged to connect. I have a child with special needs who got a diagnosis when he was 5, and I remember kind of sitting in shock in the waiting room at our one of our local health institutions right here in Durham, and they brought in the doctor had written a grant and brought in a peer-to-peer support person who had the same diagnosis as my child and sat with me and talked about the challenges and the struggles and the fears and held my hand and gave me the list of resources. And I mean, she even gave me her cell phone number, and it turned out she lived near one of my girlfriends down the street, and I was like, I know you. And the conversations that bloom out of peer-to-peer support. And then when I was at a health thing and I heard other health institutions are starting to hire community health workers to be available all over the community in lots of different settings when people are struggling. I think that is one of the most interesting and transformative ways of support. I'm obviously a big fan of peer-to-peer lactation support since I came into the work through that lens. I also will share my bias that I think the Breastfeed Durham website is amazing. Bernadette calls it my third child because it requires lots of maintenance and updates to connect with, everybody here you see, but all 2,000 different community advocates, healthcare providers, and parents, all lifting just a little edge of this lactation support quilt that we're doing. And I really appreciate Stephanie saying that volunteer is really important. And somebody said, I think said 2 hours a week. I was like, yo, if you just send me an email like once a year, that would be good. And don't trivialize that, because sending an email saying like someone's like, Love, one of those links are broken. I'm like, oh shoot, let me go see if I can fix it right now. That actually really helps that parent who comes behind, who's exhausted and tired and can't figure it out. Or one of all of these affinity groups that and all of this work that you see all grew out of someone who was a secretary or a provider who sent us an email and said, Hey, Love, I'm really worried about this thing and I don't feel safe and secure at my institution to bring it up, or I tried bringing it up and I couldn't figure out how to do it. Can you all work on this? And we literally sit around every 2 weeks on it's going to be Mondays in May. We're going to start meeting Mondays at 10:30 every other Monday. And we all get together who work on the implementation team and we say, we got this email, we got this homework from the community. How are we going to solve this problem? Thank you.
Love is making me teary-eyed as well. Okay, so we're going to think a little bit kind of on the other side of things, how our healthcare providers can actually leverage their position to influence and improve public health policies related to lactation. And Stephanie, I'm going to pass it to you.
There we go. Okay. So I'm definitely going to say using your voice is it's the biggest thing that you can do. And it's to some people the simplest. Some people, that's kind of hard and that's something that they struggle with using their voice. But using your voice is really ultimately the biggest thing that you can do, if you're in healthcare, making sure that you're an advocate, right? Like we need you as a professional to advocate for laws and funding. We need you to advocate, with your local legislators and testify at hearings about the importance of lactation for infant health and maternal health. I think it's something that only requires your time, and it doesn't matter if you're the most well-spoken person or not. They care that you have these credentials. They care about what you do in healthcare. And so the powers that be, they need you to speak out, because if you don't, they don't have the expertise. And so they can't make the best ruling sometimes if we do not have people who are working with families speaking up and saying, hey, no, we need paid maternity leave because this is going to support something that's so important for the community. And so it's it's I hate to say something simple, because again, for everyone, speaking up isn't the easiest thing to do. Using your voice isn't the easiest thing to do. Sometimes that requires you to be a little bit braver. And in this current political climate, it really requires you to trust that you're not gonna get put in jail for speaking up, right? Like things that kind of never thought would be, and where we are, it is. And so you really have to be brave and use your voice and fight for what we know is right when it comes to lactation, and that is supporting the community the best way that we can.
Thank you so much, Stephanie. And Alicia, I'm going to pass it to you now.
I have so many thoughts. On a on a very broad spectrum, connecting with groups that are doing birth equity work, like Stephanie's group, Nourish and Thrive, Joy Spencer's group, Equity Before Birth, Moms Rising. All of those groups are doing huge things in North Carolina. And I'm sure that there are similar groups that are doing things in other states, I don't know, more national level, but get involved with those groups. I think, if you're afraid to speak out on your own, connect with your community. Your voice as a group, as a community, can be heard, and it doesn't put you maybe individually in the spotlight. I think on a smaller level, looking at policy changes in a healthcare system level, just coming from working in healthcare systems for the last 15 years, I hear the same things over and over again from folks in the WIC and lactation support space and the healthcare provider space that I think we should get loud about. I think that medical visits in clinic for prenatal and newborn and postpartum patients should be 40 minutes. I think that there should be more space in there for us to have conversation with our providers about what's going on with our health and addressing our questions and our concerns. You cannot accomplish very much in a 15 or 20-minute visit slot with your provider. And I know that a lot of the providers that I work with wish that they had more time with their patients. And I think that if we collectively get more loud about that, maybe we'll be able to make changes. I think normalizing an interface between traditional healthcare providers and more kind of peripheral support groups like WIC and lactation and doulas is really, really important in terms of supporting our community and our patients. We are all serving the same people in the same community. We should all be having conversation together, making decisions and helping support our patients and each other together instead of in our own siloed spaces. So normalizing that kind of cross-specialty, cross-departmental, cross-agency work, I think, is so, so important. I think another thing too is helping advocate for our healthcare providers to gain additional lactation knowledge and skill set and specialty credentials so that they can better meet the needs of their patient population who have some complex infant feeding concerns. Because that a lot of our community don't necessarily have access or the funds to get lactation support from private practice home visiting services. There are wonderful people out there that are doing private practice lactation, but it's not attainable for a lot of people in our community. It costs a lot. And not all OBGYN, family medicine, and peds practices have lactation support available, and it just makes it really hard. I think too, trying to find ways to support within the community, access to support that can be accessible to folks regardless of their socioeconomic, their linguistic, their cultural preferences and where they're coming from, and what type of health insurance they do or don't have. Making sure that we're standardizing the access to those types of support services and education services is just critical. It's just like a human right thing. Like, it's something we should all have access to. And if you look at the way that systems work in other countries, this is just standard across the board, and we're having to fight for it here in the US. And I think that we need to take a look at what our neighboring countries are doing and mimic some of their work.
Thank you so much. Stephanie, I saw you had a hand, so yeah, I'm going to pass it right back over to you.
I just wanted to add really quick, listening to, like, we want to use our voice, but we also want to listen to our community. I had a conversation with Love before about something else, but we think we have all the answers. We come up with like this great idea in our head. This is going to solve what we perceive as the problem. And then we talk to people and we realize, oh wait, they don't need another this. They need access to transportation to get there, right? Like, everybody's needs are different, but if we listen to the people in our communities, we can hear what they need so we can properly advocate for them. So before we are loud and using our voice, we need to listen to our community and make sure that we're hearing what their needs are specifically so that we can make sure that what we're doing is in line with what they actually need. And so I just wanted to throw that out there because sometimes we get very zealous, especially when you're passionate about the work that you do and you really do want to advocate for policies that are going to positively affect people's lives. But it starts with listening to what they need and not thinking that we are the master of it all, that we know everything. And even if you have this wonderful idea, knowing this may not be a wonderful idea for your community. Maybe it's something that somebody else needs, but your community needs you to listen and give them what they specifically ask for.
I want to add upstream thinking too. I think a lot of us working in healthcare, we work in this space where you're always in a crisis response kind of mode, where people have emergent issues and you're trying to fix them on a Friday night at 11:30 p.m. and it's just like your resources are limited and your time to address it is limited. So I think looking at the landscape of what we're all experiencing, what the community is saying, where the gaps are, what we need. And instead of saying, well, we have these things in place so that when that happens, we can respond, instead looking further upstream and saying, how can we put things in place way before this so we don't get to that place where somebody is sending out an SOS signal? And I think we'll all be healthier and less exhausted for it.
I totally agree. Thank you both so much. I want to think a little bit about, and we've definitely touched on this thus far in the conversation, but what role do community support networks play in bridging the gaps in breastfeeding support, and how can these networks be strengthened or expanded? And Amber, I'm gonna send it to you.
Great. Much like Love, my entry into this world was through a peer-to-peer, completely volunteer-run organization. It's called the Leche League. I tend to think everybody around the world knows about the Leche League because it is the world-leading peer-to-peer support thing. And no, not everyone knows. Not all providers know. Not all, surprisingly, lactation consultants know. So, getting the word out. Someone had already suggested representatives of your organization going to the other organization so they have a face, they have a name. A lot of times when we get referrals to the Leche League groups from people's doctors, the person's doctor knows about us, or use the Leche League when they were nursing. So I'll say that a peer-to-peer support group is uniquely different from a lactation consultant one-on-one relationship. It's uniquely different. To be a leader, we do have training, but we also have to have fed our own child human milk for at least 1 year so that all the leaders that are representing the Leche League have lived experience. Now, what Love says, what I have noticed in the queer community, Durham's amazing. We've got more diverse leaders than your typical hetero white leaders. Durham the Leche League special, but as an organization as a whole, I think depending on where the chapter is that you're looking for, it could be less diverse than a general population. I do think La Leche League US is making really conscious strides towards more diversity. It gets a little more complicated because La Leche League International is in every country around the world. And so, whatever the international rules around the Leche League, they're in a lot of different countries with a lot of different gender expectations, a lot of different governing bodies. I do understand why La Leche League International is sometimes mum on some issues, but at least our local US La Leche League is making bigger strides in diversity, more BIPOC specific support. We still don't have a national queer support, but we're working on it. But the peer-to-peer saved my parenting life and has saved so many other parenting lives. And the difference is because it's parent to parent. And I think that's why I've been a little sad. The pandemic really crashed our in-person meetings, and they haven't come back yet. We have in-person meetings once a month, but the attendance has not come back. And so that's been a little hard to see. What just one of those things. This is how it was before COVID, and this is how it is after COVID. A lot of people are getting their lactation advice online for better or for worse. So as leaders, we are kind of talking about keeping up with the changing times. And if people are moving online, what does that look like for peer-to-peer support? I personally love that people can text me. So as a busy parent who's also running a nonprofit, taking calls is maybe not great, but also if you're a millennial or an older Gen Z, you don't want to talk on the phone either. So you can text me, and I've had amazing helping calls all through text because then I can copy and paste resources, and it's just a different conversation that when people if they have learned what La Leche League is, they know they're not calling a lactation consultant. They know they're calling another parent who has lactated, and we are trained to use very specific language where we're not giving advice, we're giving information, and it's one of my favorite parts of my community and has been since I was pregnant 8 years ago. So I think peer to peer is struggling a little bit right now. I think in the very beginning, someone mentioned community in general, community in person in general is struggling. But there's a lot to be said for getting kind of like this pregnancy centering. Like you'll get people who come in with babies within a few months and then they'll grow up together over a few years, and then you'll see them pop into a meeting after not seeing them for a year and they'll be toddlers and you'll get to have that connection again. So what I always try to tell people is that what La Leche League is, that it's here, it is 100% free. We never charge for anything. And you can call us, text us, come to virtual online meetings, and we're back to in-person meetings. So we're working on the diversity, but there's really nothing that can replace parents helping other parents. And we invite grandparents and aunties and uncles. And so that's just my shout out for what La Leche League does for the community.
Thank you so much. The more support, the better, right? Love, I'm gonna send it to you.
So I was thinking, I was like, It's funny that this is a repeat of what we did last year. And part of our step 6 is to have this conversation about gaps in care every year. And I was like, y'all haven't talked about that many gaps. Does that mean we filled them all? And we're coming to an open session. So one of the things I want to hear from everyone is, where are the gaps in the places that we're still working? I am hearing that we need to support parents on getting back out to get support in person, not just online. And particularly, I'm less concerned when folks are getting interactive online support, but when you're passively watching a short form video, or passively seeing pictures of people online, those aren't necessarily representing people's like real life. I can take a picture, like, look, y'all, it looks really nice right here, but if you turn my camera, you will see the chaos over here, right? And that's what it looks like in real life, is that you can take little windows of perfection, but when you turn and look at all the parts of life, there's a lot of chaos. And I think that in order to combat some mental health challenges that we know exist in the postpartum period and just as women and humans in the world, um, being held to imperfect standards is not reasonable. I heard that one of our gaps is continuing to bring up more linguistic support resources. We know last year we talked, we're working on Medicaid, y'all. We're trying. Um, and we know from the challenges with Western North Carolina having funding and policy support for infant and young child feeding in emergencies. So we know that. So I'm curious if I was like, if I can open the floor to hear what other people's gaps that they're seeing are, and if anybody strikes an idea from listening to this conversation, what's one thing that all these people on this call might be willing to commit to over the next 365 days? Just one thing that you might be willing to do to address a gap in care. Are you willing, if some of these folks who are peer-to-peer lactation support saying like, I'm going to do one more in-person meeting. I'm going to reach out to a friend. I'm going to hang a poster, a lactation support poster in my office. Um, so I'm just curious. Would that be okay, Anne, if we open it up?
Absolutely.
Anybody? Are we just going to all be quiet? If you all are quiet, then I'm going to be like, we're done. It's perfect. Durham's done.
I'll start. While Amber was just speaking, I was looking up La Leche League in the 2 counties that we serve for WIC. Chatham County has 2 women who provide La Leche League, and I've never met them. In the 10 years that I've been at Piedmont Health providing WIC services, I've never connected with the La Leche League group in Chatham County. So I just wrote down their contact information and their names, and I plan to reach out. And I was also looking at the Orange County group, and their website needs to be updated because they don't have any 2025 meetings. But so I was also going to reach out and just say, hey, what's your 2025 schedule so we can start sending some of our WIC families over to you?
Because they don't have any. Wake County is struggling. Yeah. So we just, everyone always needs volunteers. I think we've already said that. Everybody, time is a really precious thing. And it's hard because Durham has 10 active leaders and Chatham has 2, and Wake right now, they lost their last one last year. Oh no, Stephanie, are there actually meetings that just aren't posted?
So we have 3 leaders, including myself in Wake County, but instead of all the different groups in Wake County, we just have one. So we're La Leche League of Wake County now, and we hold a meeting once a month. It's been tough. One of our leaders recently had twins. The other one has like some work conflicts. And then I have had some kind of scheduling conflicts. So it's been tough. But we are still active group, just not as active as maybe, we could be. But we started 2025, maybe 2024, holding meetings again. So there is that opportunity in Wake County. It's just we went from having multiple groups to having one group for the entire county. So it's a tough thing.
Thank you for doing what you do, Stephanie. Sorry for misinterpreting your county.
That's okay.
And I'll add for those of you who are on the Raleigh side of Durham, or you might be over in Wake County, the North Carolina State University Lactation Program has a program off in Fuquay, and they meet once a month. It's not exactly peer-to-peer support, but a lot of the students, and it's a great way to connect with families, and that does exist. But I think I just do want to echo, we know that it's hard to get people back out because Mothers of Raleigh has existed for, I don't know, 30 years or something. And they're having their closing picnic this in a couple, 2 weeks. So,
I
but
think
they
it was 50 years. They went for
50
like
years.
52 years. Yeah, and they're closing now.
Yes, but they did generously donate half of their meager support fund. I mean, it was just a little bit of money, but to Breastfeed Durham and the North Carolina Breastfeeding Coalition, they split between those two. So we feel really honored that they recognized the support and the work that we're doing. All right, y'all. Any other, where else are you seeing challenges? Anybody?
I have a thought. I don't know if people can hear me okay. I had to be in the car. Can people hear me okay?
Yes, we can
Yes,
hear
we can
you.
hear you.
Okay, thanks. My name is Asia. I live in Western North Carolina, and I'm a lactation counselor, but my primary training is as a speech language pathologist, and I work with like pretty medically fragile babies, babies who have had NICU stays. And a lot of the families that I've worked with, by the time they come to me for feeding therapy, they've been just discouraged, just haven't had the support that they needed during their hospital and NICU stay. And I understand like the point is their baby's survival and just like getting what they need as a family as well. But I find that it at least my impression is that a lot of the specialist support, like medical specialist support, it's pretty heavily formula focused, and a lot of families are discouraged from from providing human milk to their babies. And I think in a way it can be a convenience, and I understand that choice for families, but some families really feel a lot of grief at not knowing how to provide that for their babies, and not maybe I don't as a NICU team or whatever, people not having the all of the information about how beneficial human milk is, especially for those medically fragile babies. So yeah, education or support within that specialty medical community, I think would be really supportive for families.
Hey everyone, Jess speaking. I just want to piggyback off of you, Asia. Thank you so much for sharing your experience with your parents and families who I'm sure are very grateful for your support with their NICU babies. Um, yeah, I think what I'm hearing, and hopefully I've interpreted correctly, but I'm hearing a pretty strong consensus about collaboration between community health workers who know their community and various sectors of the healthcare system, being essential for, equitable lactation care. Um, so I want to take both like a moment to celebrate and reflect, because I think while some hospitals in the triangle are doing the work and have become baby friendly or have lactation consultants in the NICU or have adequate lactation staffing, there is still kind of like Asia said, and what I've experienced as a lactation consultant, significant understaffing and lack of prioritization of either baby friendly or lactation education for our healthcare workers. Um, and that is especially true, I feel, in the NICU, but really throughout the hospital. And I think, some of what I heard is that when we include things like centering or we prioritize lactation as a topic with our prenatal care, or just connect parents with resources appropriately when they're inpatient, we have better success. It's like I heard from Amber and Love, if we get parents connected to things like La Leche League or to things like Breastfeed Durham or to things like, whatever that parent's culturally competent lactation care might be, then we can have better success. So yeah, I guess my question after that very long-winded response. Oops. I think my question is just how do we get there? And how do we kind of as community health workers partner better with our hospitals?
Well, I got half an answer. I think one of the things that I was really lucky is that my mother-in-law insisted that I go to see peer-to-peer lactation support during pregnancy. And she recommended 4 meetings. And or some people do a breastfeeding class, whatever that may look like. And I remember I really went grudgingly. I was a high school teacher at that time. I had to be up really early in the morning, and those meetings were late and they were far. But they were really incredibly helpful, but good and bad, because I remember going, I was like, these women have so many problems. Obviously, when I have a baby, it's going to come out, it's going to be perfect, and I will just put this baby to my breast and I will breastfeed and it will be easy peasy. And I don't know why I need to go to this thing to listen to all this whining because I'm going to have a perfect baby. And I always tell people the day before my child was born was my best day of mothering ever. I was a perfect mother, the best I would ever be, and it's just been all downhill since that child was born of compromise. But I remember when my baby came out and I had no idea what to do, and he was so small. I was panicked because when I had watched people feed their babies, I kept looking at their faces and their eyes when I should have been looking at their boobs. And I'm like, I tell people now, I'm like, I need you to watch people breastfeed like you are a toddler. You got to get in there and like look inappropriately so you can see like, where do you put your hands? This baby's so floppy. My boobs are so big. How do I do that? But I was lucky that I had a network, because I remember telling and I had a spouse, because I was like, I need you to find me a meeting tomorrow. I don't care if we have to drive to Virginia, like somewhere. You got to take me to the breastfeeding ladies so they can tell me where to put my hands. And I think that's what one of the things people need is during pregnancy, they have to have that conversation about how do you plan to feed your baby? And maybe they will tell you, and you would say something like, have you heard about breastfeeding or lactation? Are you interested in learning more? That a lot of folks, I remember people telling me that they didn't want some of the things that come with the baby-friendly hospital or breastfeeding, that wasn't normalized within their culture. I was like, but have you told people that SIDS basically does not exist in exclusively breastfeeding communities? Have you told people that while having your baby in your room or doing skin to skin, you might not get as much rest, but it can mean the difference between grieving a child and not grieving a child? Because I would much rather get woken up a couple times than grieve a child. And I think the problem is we hadn't told people. And I think it's really important to tell people during pregnancy. Now, the baby friendly hospital, y'all, I welcome your suggestions because I think that's our next step.
I think hospitals are more and more open to having conversation about bringing in peripheral support providers into hospital spaces. Doulas being one, they're definitely leading the charge. But I think having, peer support lactation providers and WIC and other things like that in a hospital space to help strengthen that warm handoff from inpatient to outpatient and back into the community, you're starting to see more and more openness to conversation about trying to find those types of partnerships. So we're very lucky with the health systems that we have here in Central North Carolina. But I think other parts of the country, it's worth asking to have a conversation, to meet and sit down and say, hey, there are these partnerships in these other parts of the country. What are your thoughts about trying to implement something like that here? And those of us who have started doing that work would be happy to join the conversation and share some of the outcomes and share some of the data. And I think there's women in the community who would love to share their experiences, and maybe that will help shape some of that forward progress in other parts of the country.
I'm
Yeah.
gonna
I gotta call it out. I'm like, Alicia, not other parts of the country, right here. We don't have a baby-friendly hospital. I know y'all do over in Orange County, but we're still working on it. And we have to say out loud that we continue to advocate that Duke University Health System become a baby-friendly hospital. And we believe that that is critical to creating a healthy Durham. Stephanie, I'll pass it.
I'm gonna say that a big area of opportunity is in access to proper health care with insurance. That is, we have to overthrow the system or something, but we've got to do something because people need access, and so many people, especially with the rising cost of everything right now, just they can't afford to pay out of pocket. Even on sliding scale, that sometimes just feels very unattainable. And on a scale of priorities, um, I think the general public doesn't necessarily hold a visit with an IBCLC is like a top priority for them, unless they have been super educated and this kind of been already drilled in their head of, you should see the specialist. It just seems like a luxury item, which it's not. It's a necessity. And if we just kind of make it a basic thing, just like you can go with your Medicaid and get a wellness checkup with your doctor, why can't we see an IBCLC that is not also a nurse or a nurse practitioner? Or why do we have to only have an opportunity to see a lactation person if your healthcare provider has connections with this person or has somebody on staff? I think that's a huge limitation to a lot of people. I think even just understanding the necessity, people will be more willing to go and see someone if there was access and they did not have to pay out of pocket. But it is a human right to be able to feed your children, and to not offer that support is not supporting feeding our children and giving them the best start possible. Um, so many people, when I am somewhere online, will say, well, everybody can't breastfeed. And I don't want to go down a rabbit hole with those people. And I don't want to seem like I'm shoving lactation down their throat. My heart hurts though for those people who say that, because I know that more times than not, they did not have access to a lactation professional. And so now their mindset is not, what can I do to feed my baby? It's, well, I'm going to fed is best and I'm going to just feed them this formula because this is the next best thing, instead of, hey, there's an option out there for you. It might not be the easiest option, but there's somebody who can probably help you, but it's a lot of times too late. That ship has sailed. And so if we start initially, and like it was mentioned previously, like if we start talking about this prenatally, if we start talking about this in elementary school and middle school and high school, when we have sex ed, these are huge things. When my kids get to certain ages, and I know that they've sent home a letter saying, hey, we're going to be talking about this, so you can opt out if you need to. I asked my kids, hey, did they talk about breastfeeding? And so far I have sons and they look very annoyed, like, no, mom. Or yes, mom, they did. They mentioned one thing and I'm like, that's it. That's what they said. And they don't care to be a lactation activist, but it always is something that I think about. Like, if this is something that we are teaching our children as normalcy, it later on becomes just the standard, instead of you're special because you nursed your child. Well, I'm a mammal, so my body was, doing this. Now I have access to money and all of these specialists. I'm just a human being, and I'm gonna feed my baby, and this is what I know. So it starts in so many ways, our culture and the culture in the US, and really standing up and changing things, even if you have really good insurance that pays for it, right? One of the biggest things I talk to my kids about is like, hey, just because we have it, that doesn't mean everybody else has it. And we should be advocating for other people to have access to see an IBCLC or see a specialist that they need to. So I would just say that's a big area of opportunity is making sure that we have access with Medicaid and insurance companies, and also making sure that we're talking about these things early on so that lactation is not some weird thing to people after they've had their baby, because a lot of times that's too late. If we are talking about it beforehand, you can look at it as kind of preventative um, medicine in a sense.
And with that, I just wanted to do one more plug that if we're talking about how rare it can be to see a brown nipple, or we're talking about making this something in elementary school, or you're asking your sons in sex ed, well, what about our trans folks here? What about our non-gender binary folks? What about our single by choice non-gender binary folks? What about, I mean, there are so many ways that our bodies and our family units can get children into our lives, and so many ways that we can get human milk into their lives. So sometimes I feel like I'm this like black sheep over here, but I'm like, no, we're growing. The sheep over here are growing. And the next generation is going to need informed healthcare and informed language, and I think more research and study. But in that very same, so like to me, having don't say gay bills pass in Durham County in 2024 for the whole North Carolina, so that if my child went to public school, her family would not be talked about in class. You want to talk about it starting there, let alone seeing any image of human milk feeding done by a not hetero couple. It just doesn't exist. So gaps of care there, especially for queer communities, especially in this current political climate, are vastly under attack and changing very quickly and going backwards 70 years.
I gotta give a shout out to Durham Public Schools though. They did do that, and they were very savvy with their infant feeding support proclamation that you had to click on the link before you saw the chest feeding that was very intentionally left in. Though, as we're all trying to navigate how to be in compliance with rules, um, I think I have to say our Durham Public School Board is very committed to letting people of all bodies come and feed their babies. And I think it's really revolutionary, the idea that the school board actively, and I have to say after 7 years of advocacy, y'all, but actively wanted to welcome the support of their lactating staff, employees, students, and parents to come in and be able to bring your newborn with you and be able to feed while you're volunteering with your kids in school. We knew this was a big ask, and they just passed it in the midst of protesters. Yeah, I know everyone's clapping, but I'm like, y'all, there were protesters on the streets, in the hallways. I don't, you wear red shirts for teachers as they're talking about laying off a large section of the population. Like it's so hard, and yet they're still trying to figure out how to do good work within this landscape. So yes, under attack, and yes, I think in Durham County, they're trying to figure out how to navigate survival. And I have empathy for that, where you're like, I mean, I don't want to lay everybody off. Right? How do we stay true to our values and be able to make sure people get paid? These are terrible choices. So yes. I feel like that's a downer, but yeah, I want to celebrate, and I want to remind people, because one of the languages I had with the school board, where they were saying to me, they're like, "Love, we may have to take out some language that we fought to have in here," and I said, "I don't care what we call it. We can call it lactation. I just need that everybody who came to feed their baby, especially parents, I need them to be able to be welcomed and supported to feed their baby. We can call them like hoo-has if we need to." As long as we get it in there. So I want to thank you all. Thank you all for all of your support. over the years.
Do we have any other questions from anyone on the call?
Can you hear me?
Yes, we can hear you.
Okay. To kind of piggyback off of what Stephanie had stated, I feel like um, most people's first interaction with an LC is in the hospital, and clearly there's a shortage because in order to be an IBCLC at a hospital, you have to be an RN. But a lot of times the RNs are leaving because once they take on that job, they're now getting paid less than what um, they would get paid if they just took, an RN thing. So I wonder about how, like, we clearly have lactation supporters, whether you're a CLC or, you know, whatever different credentials surrounding lactation. So I kind of just wonder, like, how can we get in there to fill the gap? Because then it almost kind of seems purposeful, where you have all these people who are more than qualified, right? That they can come in, even if it's volunteer or if you want to pay, but you're intentionally, shortening pay for RNs that's already there, which is increasing um, the lack of support there because people are leaving. And it's just like, well, now you're being faced with just a lot of hospitals reverting to formula if they're not on the train of donor breast milk. So I just kind of wonder about that, addressing that kind of barrier.
This is Jess again. Thank you so much for bringing up that point. Having been a hospital lactation consultant myself, it feels like there's 2 points of contact or 2 points to maybe address. One would be you can't fill a gap if it's not a priority. And so until lactation is prioritized, there will be no inclination from upper management to find another way or do it a different way. Um, on the other hand, though, like I think the work Alicia's doing, I want to lift that up because, I mean, they've gotten WIC inside hospitals, and I think that could be a huge place of opportunity inside Durham, inside the Triangle, to have people who work at WIC who understand, different populations have different life experiences, aren't just an RN background, to be able to advocate for parents. But yeah, just some thoughts.
Thank you, Jess. I just wrote that down on my list. I'm like, you can't fill a gap if it's not a priority. I feel like we need to have that a meme on our social media. It's phenomenal. I'm just gonna say thank you all. Thank you all for joining us and all of your support. Um, Amber, I wonder if you have any closing notes? Amber Wilkins.
Yeah, I just want to say thank you again to our moderators and our panelists for an amazing discussion today. For our participants, you should be receiving an email by tomorrow with a link to complete your course evaluation. And once you complete your evaluation, you'll have access to your certificate of completion. If you don't receive a link by Friday, please go ahead and email me and I'll get that sent out to you all. And that is all that I have today, love, if that's all for you as well. We can go ahead and wrap it up. Again, thank you, everyone, and I hope you all have a great rest of your day.